So as you've heard today, it's a pivotal moment. Deeply interconnected challenges threaten human development. Conflicts and emergencies are at the highest level since World War II. There's a climate crisis, a biodiversity crisis, and they're jeopardising food systems, jobs and health, and they're pushing communities deeper into poverty. There's growing mistrust in institutions and science, along with widening inequalities. These pose unprecedented governance challenges. International cooperation's under threat. Systems of aid and global solidarity are being restricted. And there's more reports, more predictions, and my doom scrolling tells me things are going to get worse. So despite years of development work together around the world, we face a future that we don't want. At the United Nations Development Programme, we've been working for 60 years. In fact, we've been working for 60 years in Singapore to improve people's lives around the world and livelihoods. We work to create an environment for people individually, collectively, to develop to their full potential in every country in the world and to lead lives that they value. And there has been significant progress on poverty alleviation and human development. Maternal mortality has decreased by 45%. Preventable child deaths have decreased as well by over 50%. But in recent years, progress has started to stall. And in some cases, it's started to reverse. Today, and I want to take you through a journey of a young girl born in a poor urban community in South Asia is still likely to be highly exposed to air pollution. In fact, globally, 2.1 billion people still lack access to clean cooking fuels and technology. She's likely to be malnourished. South Asia's home to 65% of the world's underweight girls and 41% of the world's anemic girls. She'll enroll in primary school, but she might not get to high school. If she finds work, the informal economy has no workplace protections for her. And at 25%, South Asia has one of the lowest female labour force participation rates globally. She's likely to face poverty and debt, and her country might too. In fact, 3.3 billion people live in countries where debt interest payments exceed spending on health and education. If she's pregnant, she might not have access to prenatal care. She might deliver her baby in candlelight. 1 billion people rely on healthcare facilities without consistent electricity. And over her lifetime, she might experience unprecedented crises, hurricanes, floods, droughts. They might displace her and her family, not once, but multiple times. Over 20 million people a year are displaced by extreme weather hazards. This is the sort of stuff that we work with. And I think we can agree, this is not the future we want for our daughters or our sons or for the world. So I'd like us to embark today on a journey to imagine the future that we do want, because we can create that together, where children are well nourished, where they're healthy, where they flourish, irrespective of where they're born, where innovation and technological progress, new medicines and vaccines are accessible to everyone. A world where human development and safety and security is advanced in harmony with nature. Transboundary challenges can't be solved in isolation. We have to take this opportunity that we have here together today to transform a future and build these new forms of partnerships that we've been hearing about and the reason why we're all here. We have to collaborate across government, the private sector, and philanthropy. And I'm not the first person on this stage to say this today. So what we are trying to do in the United Nations Development Programme is to help countries solving complex development puzzles, to look at integrated planning frameworks, to look at financing frameworks, and to look at the dynamic interactions between health, food, finance, governance, climate systems, and look at responses that work understanding the risks, the feedback loops, and looking for the co-benefits. So what we do is we work to identify leverage points where a small intervention can trigger a broader fix, where we pool resources across sectors, where there's better coordination, and to get a greater development impact than single sector solutions. We look at the laws, we look at the policies, we look at the projects to create the enabling environment so that they work together and don't conflict with each other. I'll give you an example. We'd all agree that digital tools and AI hold immense potential to transform the health sector. But while AI in health is rapidly advancing in high-income countries, it's not the same in low-income countries. And the result will widen the health inequities. But if you get a narrow project that just focuses on digital connectivity or AI capacity building, that's not the solution. Global health systems face a lot of critical challenges: unreliable electricity, inefficient medical supply chains, workplace health shortages, inadequate financing, poor systems for disease surveillance. These are exacerbated then by conflict or climate change. So the challenges are interconnected, and to work on them, you need to think and you need to leverage the benefits across the connectivities. So we have in UNDP a Smart Health Solutions program looking at the multiple threats and addressing them simultaneously. So we work to leverage new technologies and innovations. We work with the Global Fund on a Solar for Health initiative, and that's enabled 1,200 health facilities across Africa, Asia, and the Arab states to gain access to clean and affordable energy. We work in India with Gavi to support the UWIN, the world's largest electronic immunisation registry. And we worked in Pakistan to develop oxygen plants in public hospitals, the largest single investment in them. So shared threats require shared solutions, and we work in 170 countries on those. So just as I finish, I want to go into two areas here. One is around tackling air pollution, and the other is investing in pandemic preparedness and prevention and response. Both of these threaten human health and threaten development across Asia. What we're trying to do is find the innovators. We're trying to find the entrepreneurs who are developing the next cool thing, who've conceptualized an alternative future, and they've got ideas. They can figure out some of the pieces to put together to how to get there. We're looking for ways to leverage their work and give them scale. When we work on something at UNDP, we take it from tens or hundreds and we turn that into millions. We have the ability to co-invest for huge impact. So imagine that you can work on that with us as well and find the next people doing the next cool things to make change and make those solutions for humankind for the better. It could be the next generation of solar panels. It could be about advancing clean cooking or deploying new AI and geospatial tools for air quality monitoring, or many other things. Fill in the blanks. So this makes me feel really hopeful being here, being back in my home region, seeing so many of you that want to be engage together for that better future. I can see that you're interested in strategic partnerships, that you also have a vision of solidarity, not just for the region, but for the world. So thank you to the organisers for bringing all of us together for these 3 absolutely essential days. And thank you all for being here, being interested in the journey for that world that we want together for our daughters, our sons, our families, our communities, and our countries in our shared world. Thank you.